I want to ask, and I'm not entirely sure who to address this to, but this week in our largest newspaper in the state was a front page article about traumatic brain injury and how Alaska has the highest rates of TBI deaths, related deaths in the country. 1 out of every 4 deaths in Alaska under the age of 30 is related to TBI. So we know that we do a lot of rock climbing and some things that are inherently dangerous, four-wheeling, snow machining, we get all that, but the reality is of those deaths, 43% were due to suicide. Suicide attempts are more common in individuals that have sustained a brain injury, almost half of brain injury survivors reporting symptoms of depression. So the question to you all is what protocols are in place to ensure that those who have sustained a TBI get the mental health that they need, that they get it on the front end? We recognize that this is a pretty tight correlation here. Are we doing anything with regards to that? If you've had a traumatic brain injury, is there follow-up then to help on the mental health side? Dr. Ng?
Thank you, Senator Murkowski. I think that this is a really incredibly important question to ask around how are we integrating mental health and behavioral health and suicide screening throughout all of our healthcare systems. And it's really understanding that there's no health without mental health. And it's being able to ask those questions, but also work collaboratively with teams. So when we integrate mental health and behavioral health services within medical settings and primary care settings and specialty pediatric settings, it's really important. It allows us to have that conversation, to ask those questions, but also when there are issues related to suicide, that we're able to address it directly and we're not having to refer to someone else, but when you're talking within your trusted medical care team and you're able to provide that level of identification, screening, assessment, and referral to treatment, I think that that's really key.